we're trying to see how the body functions normally from the lens of doshas and Ayurvedic point of view. So, from that point of view, it's important to understand what is happening naturally in a woman's body, what makes her unique in terms of health condition, treatment factors, all of that. How do we see that changes happening and the hormonal variations happening? Not in terms of just the particular hormones, but try and understand what is uh, as a whole happening in the body, not just in individual organs. For that, we need to first look at the hormonal cycle and the changes happening in two main areas. One is the ovaries, and other is the uterine lining, the inside of the uterus. So primarily in the initial phase of, if we consider menstrual cycle as starting from the first day of bleeding or going on to the next cycle, um, the first few days, what's happening in the ovaries is maturation of the ovum or the egg inside certain cyst-like structures. It's not a cyst itself, but it's almost like a fluid-filled cyst-like structures. There are multiple ones in different stages of maturation. Call them follicles, and depending on the stage and the sort of level of the menstrual cycle, they will be in varied level of maturation. And one of them is matured, so it's more sort of a nourishing phase where the eggs are being matured with the influence from different hormones from the ovary itself, or as well as from the pituitary axis as well. And that maturation phase is very nourishing, and that's very important to note, that during the same time in the uterine lining, there is an initial sort of cleansing process happening, which happens naturally. Why is it happening naturally? Is because the process of child development of a child, a new life in the womb, has to be very, very precise. It's a very precise and very strenuous sort of an action happening in a monthly cycle. So there is no room for any error in terms of the uterine lining. So that perfection is what leads to every month the body renewing the whole lining, so that when the fertilization, if at all it happens, it is ready with as pure and new as lining for it to grow further and nourish further. So this process of renewing means there is some form of cleansing happening naturally. And in Ayurveda, when we do deeper cleansing treatments, we do acknowledge that this process of cleansing, even though it's not a complete whole body cleansing, it's a more localized cleansing, but it's happening once in a month. And when this happens, we sort of pause various cleansing treatments and then restart the treatments at the end of the cleansing, acknowledging the fact that body is already under a normal cleansing cycle. So in the uterus at this time, there is a process of cleansing happening. And similarly, like in the ovary, there is a process of re-nourishing starting. So that's sort of a kapha phase of a healthy menstrual cycle, where kapha represents nourishment, and kapha represents nourishment in the form of maturing follicles in the ovary, as well as gradual development of the lining inside the uterus. Then as we move further, one important sort of phase in that cycle will be the real maturation of one of the follicles and the ovulation, where the ovum or the egg is expelled into the outside from the ovary and gets into the uterus. So in that process of maturation, there is this first major hormonal change, and any form of enzymes, hormones, anything which is transforming or help the process of transforming is a pitta related function. It's always associated with its effect on digestion, its effect on our body temperature, how our body temperature actually elevates during that phase. And then the pitta, that cycle, that sort of change in the uterus at the same time while this ovulation is happening, there is further nourishing and further capillaries and blood circulation improving in the uterine wall along with the uterine muscle tissue. That's more sort of that pitta influence gradually developing, and that comes to the peak, I would say, just a week before the actual menstrual bleeding happens. That's where if you look at the hormonal variations after the first dip in the estrogen levels, just before the ovulation, you actually tend to have further increase in estrogen as well as progesterone, which is quite something symbolizes the pitta nature at that time, and will be at the peak just before the actual menstruation happen. And at that point, based on whether there is fertilization or whether the fertilization is not happening, then the cycle moves on to again a vata phase, which will lead to cleansing and re-preparation. So naturally, the whole female body goes through this cyclic change every month, which is very important to analyze and understand, because nowadays I think a lot of new sort of personal trainers and sports trainers, they all pay into attention how and when we can maximize the training, focus on different types of activities, whether this time of the it's a strength rather than any form of disability, because you are able to learn better in some phase, you're able to sort of practice better in some phase. You might have to focus more on repair and restoration at certain phase, which is more sort of like the phase where the vata will be higher, and that sort of reflects into symptoms related to vata like tiredness or cramps and pains, etc. So this whole change, while I'm explaining on the ovaries and the uterus and trying to simplify how these are happening in 3 different phases, it will be very interesting to note that these changes also happen in every other cell in a female body. It is happening in every other function in the female body, related to even digestion, circulation, factors related to emotions, mind, all of that. So it's not something restricted to one part of the body. It is happening all through the system, depending on a person's nature, whether they are by nature predominant in one of the dosha, whether they are predominant in vata or pitta, depending on that prakriti or their natural tendency. 1 or 2 of these cycles, stages of cycle, will be a bit more visible, they'll be in slightly higher risk towards seeing symptoms related to any one particular issue at that particular time based on their body type. So it's important to understand your body type and your nature first. That's why I started by talking about doshas, and then look at the symptom, and then look at what stage it tends to actually repeat, if it's showing a cyclic pattern, and then try to analyze the diet and plan things to rectify it. So that's what usually an Ayurvedic doctor helps when you are speaking with an Ayurvedic doctor. They will try to understand first who you are, and then go into analyzing the nature of your symptoms. It's not what are your symptoms, but how do they appear, what triggers it, and what can aggravate it, what tends to reduce its intensity. All of this is taken into account, and then a plan is made, which is not just herbs for symptoms. It's more related to like forming a routine, anticipating these changes before it happens, and taking precautions. And if there are deeper reasons, we focus on cleansing as well. Right. So that's mainly about healthy phases of sort of hormonal changes happening in the woman body.